Endodontics is the diagnosis and treatment of pain relating to teeth. It's a specialist area of dentistry and in general terms involves either root canal treatment or apical surgery. Often the patients come in pain or with infections and are referred to us either by their general dentist or find us via other sources. Patients are usually very anxious and the treatment itself is not usually too difficult. We either are doing primary treatments where teeth have got damaged either through fractures or decay or leakage around old crowns, or in some cases the teeth have been traumatized. Other times we are redoing teeth which have been treated in the past. And using our specialist equipment, we are able to redo these teeth and hopefully to prolong the life of them for many years. Often dentists struggle to do endodontics, even though they should be well trained, and will refer difficult cases onto us directly so that we can do it right the first time. The whole purpose of this, of course, is to save teeth so that people can have them for much longer and can chew comfortably without the need for extractions and then dentures or implants. When people come to us, they're often apprehensive and they're in pain and they've got broken down teeth or swellings or infections. And the purpose of the endodontics is to resolve the pain and the infection so that people can save their teeth. In the past, the options were to take the teeth out and then replace with either dentures or bridges, or these days with implants. However, a much more cost-effective and kinder treatment is to actually save the teeth themselves. This is done by removing any damaged bits of nerve and pulp in inflamed teeth so that these teeth can become infection-free. Often we're redoing treatments, and again, the ultimate aim is so that people do not lose their teeth and can have their teeth for a lot longer. Sometimes we have to do surgery to teeth, and this is when there is infection in the bone which can't be got at by conventional means and by conventional root canal treatment going through teeth. And in these cases, we will perform surgery where we lift up the gum and take a little bit of bone away, but ultimately to get that tooth infection-free so that tooth isn't lost at any time. This really should prolong the lifetime of a tooth by decades and is a very good, cost-effective way of dealing with problems. One of the myths of dentistry and endodontic treatment is very painful, and really it shouldn't be. If done well with great anesthesia, it should be a very comfortable procedure. Often people have heard stories from their friends or well-meaning colleagues that this is a very painful procedure, but really it is due to poor anesthetic techniques. And there are some teeth which are very difficult to anesthetize, lower molars which are very inflamed. But once anaesthetized, endodontics should be as comfortable as any other dental procedure. Sometimes the procedures are quite long and it's not unusual for patients to fall asleep. Also, if people are very apprehensive, they can be offered options such as different sedatives to really help with the procedure. However, generally, patients are not in pain during the procedures, as this would be counterproductive to any treatment, as we wouldn't be able to do our jobs, but also we don't want the patient to suffer in any way whatsoever. I think a calm technique and explaining everything that goes on with the treatment really does help, and we do our best to make sure the patient is comfortable throughout the whole procedure. In general terms, patients who come to us have damaged teeth with infection or inflamed nerves, and the bacteria are residing inside the canals, and therefore the best treatment is to do treatment non-surgically. This is where we access the teeth and go into the canals, cleaning them, preparing them, enlarging them, and ultimately sealing them. If there is damaged inflamed tissue, all of that's removed, and if there's infected tissue, the canals are disinfected and sealed. Sometimes patients come to us and the treatment's already been done once, but treatment hasn't gone so well. Then the primary option is to take out the initial root filling and redo it. Sometimes, however, it's not possible to access these canals In cases where there is a crown present and maybe a post cemented into the roots, in these cases we would opt for surgery. This involves lifting up the gum and taking bone away and moving damaged tissue around the tip of the tooth and sealing the apex. We only do this if the root canal treatment has failed or we can't access the canals. Also, in some cases, patients have had very new, very expensive restorative care done and don't want any potential damage to it. Doing root canal treatment may involve removing the crown and having to re-treat the tooth. So sometimes the expenses of redoing a treatment compared to doing apical surgery where we leave the crown as is and do surgery at the apex is often a cheaper option.